Hello everyone, I am Dr. Deepti Thakkar, General and Bariatric Surgeon at Live Life Hospitals, Hyderabad. Today we are talking about obesity and bariatric surgery. Now we have seen different types of surgeries, BMI, when to lose weight, how to lose weight. We come to the more important question which I am sure everyone has. What are the side effects? What are the problems? How to prepare for surgery? First of all, if you are planning for any surgery, there are certain tests which are done to find out whether you are fit for anesthesia. These surgeries are done under general anesthesia. So we see first of all whether you are fit to undergo the surgery or not. After that, before surgery, all patients are asked to stop alcohol, stop smoking at least for 2 weeks. The next thing is to do a high protein diet before operation, preferably for 1 to 2 weeks, and certain breathing exercises which are advised. After this, the patient comes for surgery. Generally, these are all laparoscopic surgeries, so the stay in hospital is just 1 day and next day patients are discharged. Because these are laparoscopic keyhole surgeries done via small cuts, pain is extremely low, risk of bleeding, infections are very low. After operation, all the patients are generally advised about 2 months of strict diet, so that the internal healing process is completed. Our dietitians provide you with diets which you are supposed to follow. What are the common problems we see when patients lose weight? One is, the most common is sagging of skin. Obviously, when you are losing weight, your skin starts to become loose. So all patients are advised to do certain skin tightening exercises. Generally, we advise exercises after a month of operation, and then you have to keep doing them till you are losing weight. Most patients can get good skin tightening just with exercises, either gym or yoga or swimming, different options. Some patients who have lot of excess weight, like patients who have high BMIs, those patients sometimes may need additional cosmetic surgeries to tighten that loose skin or remove that loose skin. The second thing is, all patients are advised vitamins and protein. Because your capacity is going to be reduced, you need to take vitamins and protein. For bypass patients, it is mostly lifelong. For sleeve patients, it is for a year or two, which is regular. So because you are eating small quantity, you have to take these additional supplements so that you don't get into weakness and other problems. The third thing which we see, which many patients complain of, is hair fall. But don't worry, hair fall is temporary and reversible. When your weight stabilizes, hair comes back. Another not very common problem which we see not immediately, but generally we see it 4, 5, 7 years after operation, is weight regain. So this is where you have to be careful. Your quantity is in your hands, but what to eat is your choice. Your quantity is fixed. But if you daily start putting in lots of calories, sweets, ice creams, chocolates, if you start going back to your old habits, again you will gain weight. So you always have to be careful. Even if you have done bariatric surgery, on a daily basis, please stick to a healthy diet. Occasionally you can indulge, but indulgence should not be daily. The other thing, that the positive effects that happen is, as you start dropping your weight, your BP, your sugars, your joint pains, back pain, they start coming down. But at the same time, there are certain things that you have to do to make sure that you don't go into weakness, malnutrition, etc. So if you have any further questions related to bariatric surgery, you can see me at Live Life Hospitals, Hyderabad.